Good afternoon to everyone who is watching this video. We are going to explain about anatomy and the physiology of the digestive system. The team is conformed by Alison Mora, Jordi Choes, Jocelyn Cardenas, and the person who speaks, Jean-Pierre Macias. Well, here is a detailed description of the functions of each part of this system. The mouth. The mouth is also known as the oral cavity, performs the following functions: food ingestion and mechanical breakdown like chewing. Saliva production via salivary glands to moisten and soften food. Mixing food with saliva to create a bolus, taste perception through taste buds on the tongue. The second part of this system is the tongue. The tongue's function include manipulating food during chewing and swallowing, taste perception through taste buds, speech articulation, and swallowing. There is also known as deglutition. Parotid gland is one of the three major salivary glands. Its function is produce saliva to moisturize food, break down carbohydrates that is made by the amylase enzyme, neutralize acid, and remineralize teeth, aid in swallowing. The pharynx is the next part of this system, and the function is it works like a passway for food, air, and sound. Muscles of the pharynx propel food into the esophagus during swallowing, and they separate air and food pathways to prevent choking from the larynx. The esophagus is a tube that transports food from the pharynx to the stomach through peristalsis, that is muscular contractions. Propels food into the stomach through the lower esophageal sphincter. The next is the stomach.
Hi, my name is Jordi Choes, and now we are going to talk about the stomach. Okay, the stomach is a vital organ in the digestive system located between the esophagus and the small intestine, with its primary function being the initial breakdown of food. It acts as a temporary reservoir, allowing large amount of food to be stored while regulating its controlled passage into the intestine. Through muscular contractions, the stomach mixes food with gastric juices composed of hydrochloric acid and enzymes like pepsin, which break down protein and form a semi-liquid mixture called chyme. Among its main functions is the secretion of gastric juices, essential for protein digestion and the activation of other digestive enzymes, as well as maintains an acidic environment that projects against bacteria and microorganisms ingested with food. The stomach also performs selective absorption of substances such as alcohol, water, and medications. Another key function is the production of intrinsic factor, a glucoprotein necessary for the absorption of vitamin B12 in the intestine, which is essential for red blood cells formation.
Okay, I am to talk about the small intestine. Long tooth-shaped organ that connect the stomach with the large intestine. It is almost 20 feet long and falls several times to fit inside the abdomen. The small intestine has three parts: the duodenum, the jejunum, and the ileum. Its function is to continue the process of digestion of food coming from the stomach and absorb nutrients for vitamins, minerals, carbohydrates, fats, and proteins, and water for use in the body. The small intestine is a part of the digestive system, Among the main diseases that occur in the small intestine are celiac disease, Crohn's disease, which is considered autoimmune, intestine obstruction to adhesions, among others.
The next one is
Hi, I'm Jocelyn. I will tell you about the organs. For example, large intestine. It is the last structure to process food. Colon, large intestine. The colon absorbs water and electrolytes, store and eliminates waste, house goods for microbiome, beneficial bacteria. Force and move feeds to the rectum. Liver. The liver metabolizes nutrients, carbohydrates, protein, fats. Detoxifies harmful substances produced by for fat digestion and absorption. Store glycogen and vitamins. Regulate hormone production. Pancreas. The pancreas produces digestive enzymes for carbohydrates, protein, and fat breakdown. Regulate blood sugar levels through insulin and glucagon production. Produce hormone to control the digestive process. And finally, rectum. The rectum stores feces until elimination, expand to accommodate fecal volumes, signal the need to defecate. Anus. The anus controls fecal elimination through sphincter muscle, regulates volume movement. These organs work together to facilitate digestion, absorption, and elimination of nutrients and waste products.
Well, the formation of the ulcers in the gastrointestinal tract. Well, pathophysiology of gastric ulcers are open sores that develop on the lining of the stomach. The primary factors contributing to their development are Helicobacter pylori infection. The bacteria adhere to the stomach lining and produce urease, an enzyme that neutralizes stomach acid. Inflammation. The bacteria presents triggers an inflammatory response, leading to damage to the protective mucosal layer. Then it causes a disruption of the mucus that can interfere with the production of mucus, which normally protects the stomach lining from acid. The usage of non-steroidal anti-inflammatory drugs, NSAIDs, inhibition of prostaglandins, reduce the production of prostaglandins, which help maintain the integrity of the gastric mucosa. Increased acid secretion, decreased prostaglandins can lead to the increased acid secretion, exacerbating the damage to the stomach lining. The NSAID can also directly damage the mucosal barrier. Another factors are like excessive acid production that is called hyperacidity can contribute to the ulcer formation by overwhelming the protective mechanisms of the stomach. While not a direct cause, chronic stress can exacerbate existing ulcers or contribute to the development of new ones. Smoking can impair healing and increase the risk of ulcer recurrence. Alcohol abuse consumption can irritate the stomach lining and contribute to ulcer development. In summary, gastric ulcers result from an imbalance between the aggressive factors such as stomach acid and H. pylori and protective factors such as mucose and prostaglandins. When the aggressive factors outweigh the protective factors, ulceration can occur. The symptoms of gastric ulcer can cause a variety of symptoms, but it's important to know that some individuals may experience no symptoms at all. When symptoms do occur, they often include abdominal pain. This is often the most common symptom and can be described as a whining and burning sensation in the upper abdomen, especially when the stomach is empty. Heartburn, a burning sensation in the chest that often rises up from the stomach. Nausea and vomiting. These symptoms may be accompanied by loss of appetite, bloating and gas, feeling full or bloated after eating, along with increased flatulence. Weight loss. If the ulcer is causing significant discomfort or preventing you from eating normally, you may experience an intentional weight loss. Black or tarry stools. In severe case, bleeding from the ulcer can lead to black or tarry stools. In summary, gastric ulcers result from an imbalance between the aggressive factors such as stomach acid H. pylori and the protective factors such as mucus and prostaglandins. When the aggressive factors outweigh the protective factors, ulceration can occur. The indication of a colonoscopy is ordered when there are symptoms suggesting a problem in the colon, such as rectal bleeding, changes in bowel habits like persistent constipation and or diarrhea, persistent abdominal pain, and unexplained weight loss or anemia. It also performed as a screening test in individuals with risk factors for colorectal cancer, such as a family history of the disease or certain genetic conditions. Additionally, it can be used to diagnose and remove polyps, which are abnormal growths in the lining of the colon that can become cancerous if they left untreated. In summary, a colonoscopy is performed to diagnose problems in the colon such as inflammation, ulcers, or cancer, detect precancerous polyps and remove them, prevent colorectal cancer through early detection and removal of polyps. It's important to know that the decision to undergo a colonoscopy is made by a specialist doctor who will evaluate your medical history and symptoms. Well, that is everything that we are going to explain today, and we are going to say goodbye to all of you viewers. Goodbye.